All right, like I told you guys earlier, open enrollment is on its way. It's October 7th, if I'm correct. It starts, and it's basically for about 2 months, October through the beginning of December. And open enrollment, for those people who aren't for sure, it's where you decide if you want to go back to Medicare, maybe choose a Medicare Advantage plan, switch plans, buy a new plan. I don't know. Well, Alex is going to tell us all about it. It's very confusing, isn't it, Alex?
It is confusing for many people, but we help you out with that.
All right, we got Alex Rascionato.
You got it.
Oh, man, I even impress myself some days. He's with the CMA Health Agency. And so now tell me what you guys do exactly. Are you like an insurance agent? Is that?
We're an insurance brokerage, so we're an independent agency that helps people with their education on Medicare and also health insurance and helps them to get their policies.
Now, there's a lot of people that are confused, especially, now we have all these baby boomers hitting 65. And, we're in our second year of baby boomers. And they probably come into you and, well, what do I need to do? What can I do? What am I supposed to do, right? Do you get a lot of those questions?
We get a lot of those. So we start out with all of our clients doing an education. We go back to the basics, teaching them about Medicare. If they're not on Medicare, we teach them about health coverage. And then we help to design a plan that works just for them specifically.
This is really a key time for seniors, isn't it, these 2 months? Because they've got to make either they stay where they're at, stay with Medicare, or make a decision to make a change that's right for them, right?
That is true for many people. There is an annual enrollment period that starts October 15th and lasts through December 7th. So for some that take certain types of plans, that's when they can make the change. There's others that stay on Medicare and buy supplemental policies that can do that all year long.
And now, does your agency handle a number of different companies and policies?
We do. We handle several different companies. We really try to take all the major carriers, and then we also cover the whole country. So there's different rules for different people, but we try to find what's best for everybody.
Cool. We're talking right now to Alex Rascionato with CMA Health Agency. They're an insurance brokerage here, mostly handling Medicare Advantage plans. You can find them at stressfreehealthcare.com is their website. It's AM 1470 WMGG, Evan and Deb in the afternoon on health, wealth, and wisdom. All plans are not made the same, are they, Alex?
That is absolutely correct. So just because your best friend or family member has a plan doesn't mean it's right for you.
We've talked about that. We've had, Shine on our show a number of times. That's the not-for-profit group that helps people make choices. And, we talk about that all the time, that, Susie is in apartment 1A, and Mary comes over and says, well, what insurance do you use? And Susie uses, let's say, Humana. But Humana might not be right for Mary, right? But she goes on Susie's plan, and she maybe should have been with United, right? Because for her health needs, it's just different.
Correct. Everybody's different. So you don't want to make a mistake, especially if you're taking one of the plans that you have to stay on all year. You want to find the right one for you so you're not suffering with that for the whole year.
Now, a lot of people might run and go to those seminars. Specific companies put on seminars about their plans. They really need to get more information before they make a decision right there, don't they?
That is correct. It's good to go to the seminars to get some education. It's very nice to have a one-on-one appointment with somebody because then they can find out what personally works for you. And one of the things that we do is we offer those appointments and we offer the seminars, and we have no brokerage fee. And so it allows them to come and just get an education without having to commit to anything.
All right. I like that. And now the difference between Medicare Advantage and Medigap plans, that confuses me, and I'm not even there yet. So I imagine like a 75-year-old person would be quite confused sometimes.
Yeah, don't feel bad. That confuses many people. So the Medicare Advantage plans are the ones that you see advertised quite a bit. They have an annual enrollment period from October 15th through December 7th. Those plans are a little bit different than your Medicare supplements, which is where you stay on original Medicare and you get a policy that fills the gaps. You can get those anytime throughout the year.
Oh, okay. And now you sell those as well.
We do.
Right? So you're able to sit down with people and say to them, you know what, maybe you're better off staying on Medicare and choosing a Medigap plan, right?
That's correct.
So, and that's important because, I've seen it too. People go to an agency even, and that agency only handles one carrier. Well, who are they going to sell, right?
That's right. They're going to give them the best plan that they have for them. We try to go with the best plan for the individual.
Excellent idea. Now, so what else makes CMA Health Agency different from, let's say, other agents, other than obviously the ones I just mentioned that only carries one plan?
Right. Well, the education is the biggest factor. Not only do we do the one-on-one education, we have seminars, such as next Friday, we're holding a seminar at the Tampa Club. And with healthcare reform, more and more of the healthcare reform laws coming into place, people are confused how that affects them. So we take the
Obama's confused. The Senate's confused. They're voting today. Nobody knows what they're doing.
We've taken the approach that it's here, and so we have to work with what we have. And so let's find the best thing that's available for you. Right. That's what we're educating people on now.
It seems that Medicare really didn't get screwed on the whole thing. Medicare seemed to get a little bit better off. They're closing up the donut hole. There was something else I was talking to someone else earlier this week that they're doing. They're doing better things for Medicare. It's the rest of us that aren't on Medicare that I think are a little bit more in trouble. I think Obamacare has really sort of benefited it there, hasn't it?
Well, it started in 2010 with the rules that have changed, and it has been getting better and better on the Medicare side. So there'll be some changes over the next year. Right now, we're not seeing an astronomical amount of changes to Medicare, so we'll see what happens going forward.
Right. What's the biggest mistake you would say that people make when it comes to making a choice between Advantage plans?
Not getting an objective education. So going to one company, finding out what they have, and not finding out what's best for them as an individual. It's really some key questions that should be asked, and they should consider how their health is and how their lifestyle is before selecting what plan is going to work for them, because then they'll know what options are there.
Okay. Now, so Deb's mother decides she wants Deb to come in with her and really go through it all with you. You welcome their adult children, don't you?
Absolutely.
So
I was wondering if when we look at a health plan right now, we go through all of our doctors and we see who accepts this, who accepts that, and are part of the plans. Is it the same thing with Medicaid? You've got to Medicare, you've got to find doctors that accept that, or does everybody have to?
That's a great question, because on Medicare Advantage, many of those plans are HMOs. Your Medicare supplements or your Medigap plans, there really isn't a network. You use any doctor, any hospital in the country that accepts Medicare. And so really, if you want to stay with your doctors, that's where we would look at which plans they accept, or maybe if you travel and use doctors in multiple states, staying with the plan that you're not going to have to worry about a network.
Right. Very cool. And how long have you guys been in business?
Our agency has been around 3 years. We have about 40 years experience between our agents that are in the office, but we started this as an independent agency 3 years ago.
Okay. All right. We got a lot more coming up here. We're from the Manhattan Dolce and Bistro today, live remote. We're giving away prizes. They have drink specials, food specials. Come on out. The place is starting to get a little bit busier, and they're going to have a band tonight, aren't they?
Yes, they are.
That band all weekend long they typically have. We're talking right now to Alex Rascionato, and he's with the CMA Health Agency. You could find them at stressfreehealthcare.com. They also have a Facebook page. Their phone number, 855-258-2580. All right, plenty more coming up. AM 1470 WMGG. Evan and Deb in the afternoon. Health, wealth, and wisdom. All right, AM 1470 WMGG, Evan and Deb in the afternoon, health, wealth, and wisdom. All right, we've got Alex Rascionato with us, CMA Health Agency. We're at the Manhattan Dolce and Bistro right now in South Tampa, the corners of El Prado and Manhattan. It's a great club. It's one of our favorite clubs in Tampa. Also a great restaurant. They have live music most of the week. I think they even have karaoke some nights. One of our favorite listeners just gave Deb a gift here, and we have that rivalry between us. It's a split household. I'm a Cane, she's a Gator, and she got a Gator cup. So I don't know. I've got to live with this 20 years. It's rough stuff. Alex, do you go to school here in Florida?
No, I did not.
Lucky you. See, you never have a problem if you marry one of these girls that went to Florida or Florida State. Nope. So, where are you from?
I was born in New York, but I'm raised in Florida, so I've been here most of my life.
Where are you from in New York?
Long Island.
I'm from Brooklyn.
Okay.
So we don't really sound it. So,
no.
Where did you move to? When did you move to Florida?
I was 1 year old, so 1975.
Oh, where did you move to?
I moved to Orlando.
Oh, okay.
Grew up in Windermere, and then I came to Tampa.
So you were like me, part of that group. At 5 years old, my family kidnapped me to Miami, and that's where I had to grow up. But it was a pretty good place to grow up, better than Brooklyn.
It's a nice sunny place. So I'm good here.
All right. So now, what's stressing people the most right now with all the healthcare changes?
What we're hearing is healthcare reform is stressing people. It's stressing business owners. They're not sure how it's going to affect their business. It's stressing individuals because they're afraid they're going to have to pay a penalty, or really what's called a... Josh, you there?
Okay, we're still on. Go ahead. I don't know. we're okay because you know what? We have a unit here that's battery powered. It's very cool.
Very good. Well, one of the things that we're trying to do with people is really educate them on what changes healthcare reform brings. There's a lot of misinformation out there. A lot of people hear somebody say something and repeat it. So what we've done is we've actually studied the laws over the last year. We've taken some courses, gotten the education, and now we're able to share with people what options they're going to have. So it's not as stressful as many people think.
Right.
If they get an education and talk to somebody that knows the answers.
I like, and and so what when you're talking to seniors, I mean, they come in, they're nervous in general, a lot of trepidation. What information are they being given sometimes that's erroneous?
But many times they're given the information that they can't change their plan. Many times they're given information that really isn't going to be accurate going forward, and so they may realize that they took a plan that didn't cover their prescriptions, or they took a plan that their doctors don't accept because they thought they had to take that plan. And so many just don't know that they have many options available to them.
And each year you have to check if your doctors are still going to be on the plan, right?
That's correct. The doctors on the Medicare Advantage plans could decide not to take those even halfway through the plan. So it's always good to review it at the end of each year during the annual enrollment period.
Right.
Prescriptions and doctors.
Right. And you have, you have these things where people sign up and then a month in, they don't like the plan. Maybe it doesn't work for them and it's kind of weird too, isn't it? The doctors can drop off the plan after you've signed up. Isn't that true?
That is a true statement.
So let's say in mid-January, they found they lost 3 of their doctors because XYZ company cut them or they didn't want to be part of that plan. They have recourse, don't they?
They do. There is a disenrollment period that goes through February 14th of each year. And so they can come off of that Advantage plan and back onto original Medicare.
Okay. And that's the only way they could do it. They could just go back onto original Medicare. They can't go, okay, I want to go from X to Y. They can't do that kind of stuff.
That is a true statement. There's a few rules depending on the type of plan you want to go into. Maybe you can switch. That's where you need to talk to somebody that understands the rules.
Okay. Now, you say you don't charge a fee for your services. Are there agencies that charge fees for this?
There are. We're starting to see more and more of that. Some of the laws that have taken effect since 2010 and going forward are limiting the commissions that the insurance companies pay to the agents. So to compensate for that, many have started charging fees. We haven't done that. Instead, we still do the education. Our agency is built on 100% referrals, so we just get more clients versus charging more money to the few clients that we have.
Okay. And how many agents do you guys have there?
We have 7 agents.
Wow. Okay. So you can handle, obviously you can handle a lot of people. And now people that are turning 65, there's a little different rules for them, aren't they? Have extra time sometimes. How does that work?
They have an open enrollment period. And so when you first turn 65, you have a 6-month period to look at your Medicare supplements or Medigap plans, and it's a guaranteed issue at that point. You don't have to go through underwriting for health questions.
Because if you do nothing, you're getting your Medicare card, right?
That is typically the case. You're going
Right.
to get your Part A, unless you elect out of Part B. Typically, you're going to get that.
Okay. And so now, would you advise if someone's going to stay on Medicare that they should have a Medigap plan?
It makes sense. It really limits their exposure. And so it's going to give them the coverage that they need so their costs are much more predictable.
Okay. And what about the prescription plans? How does that work these days?
Well, if you're getting a Medicare supplement plan, then you're going to want to add a prescription drug plan in with that. Typically in any county or market you go to, there's going to be 35 or 40 plans. So we go right to Medicare site, shop those plans for our clients, and show them which one's going to be best for them.
Okay. And now, are there reasons somebody would say, I want to stay on Medicare and just, give me a Medigap plan or give me a prescription? Because there's so many plans out there. I mean, what are they up to now? M, N, or O? I mean, it's insane, isn't it?
It goes to N. That's correct.
So if someone said that, okay, I want to stay on Medicare, I'm going to opt for this. You get people that choose that direction, right?
We absolutely do. Some choose to stay on Medicare. Really, nationally, we find most of our clients are on a Medigap or Medicare supplement plan. Florida has really good Medicare Advantage plans, so it's always worth the conversation of exploring which option is best.
Now, one company went under the government seized them, about 3 or 4 months ago.
That's correct.
And that happens from time to time, this goes on. When something like that happens, or someone, let's say, moves into the state, there's different rules for them, right? They can then opt to go where?
It's called a special election period, and they can basically start over. They can take an Advantage plan, or they can go back to original Medicare and just take a supplement at that point, and the same rules apply. They don't have to worry about underwriting.
Alex, you really know your stuff. Did you study before?
We study it. That nice big book for Medicare that comes out each year, Medicare and You, we study that every year, so we stay familiar with it.
That's good. You know what? It's unfortunate. There's too many people that sit down, right? And the daughter comes in or the son comes in. I'll handle this for you. I know what I'm doing. And then before mom knows it, she's like, it's June and she's screwed, right?
That happens quite a bit, unfortunately. So there's just a lot of education that you have to do to stay on top of things. Just to give you an example, not only do we study the Medicare rules and healthcare rules that come out, we're also members of the National Association of Health Underwriters. So we participate in those conferences. We take educational courses from them as well. And we really try to stay in the loop when it comes to what's coming out for healthcare.
You're not going to believe that. They were a client of mine years ago.
Really?
The NAHU. Yep.
Yes.
Deb and I used to work with them. We used to manage
sold
their,
them.
I'll tell you later. We used to do a lot of their stuff.
All the meetings.
So, in Washington, D.C. So,
well, hopefully it was a good relationship.
it was.
Oh, yeah.
It was.
Great.
We made them a lot of money. They enjoyed our relationship.
Okay.
So,
How long does this process take? So I go to a seminar and I get a little bit of education. Then I make an appointment to come in. Are we talking about I bring you what I have, or I bring you my doctor's names and we're ready to go after that appointment? Or that's it?
Sure.
Okay.
Yeah, we typically will spend about an hour to an hour and a half with you. And we're going to make sure at that point you're comfortable with what your decision is. And then it goes quickly from there.
And do you help us get enrolled in the new programs, or do we take home paperwork to do that? That's all done.
We do help you get enrolled in the plans.
Okay.
cool. All right. AM 1470 WMGG, Evan and Deb in the afternoon, health, wealth, and wisdom. We're coming at you from the Manhattan Dolce and Bistro in South Tampa, at the corners of El Prado and Manhattan, just not far at all from Gandy. And we're talking right now, like I said, Alex Rascionato with the CMA Health Agency. You can find them at stressfreehealthcare.com. 855-258-2580 is their number. Do you do you just handle Medicare plans? Do you handle other types of insurance as well?
We handle individual and family plans. We handle group plans for business owners. And then we also do life insurance, and we do annuities and long-term care.
Now, those people, they're like us. They're coming in. They got to be really confused at what the hell's going on at this point. You know, now we got everybody trying to defund it, and the other side trying not to defund it. I'd like refunds. That's what I would like. You know, and and what happened? You know, the guy that got elected in 2008 said our insurance rates were going to go down. What happened, Alex?
Here's what we can help you with. We can help you find a plan that's probably going to save you money.
Okay.
That's the best we can do. We can work with what we have.
Okay.
And you can either come in and see us for that. We actually have a website that you can shop and compare many companies right there without even having to talk to us. And then when you formulate some questions, then you can talk to us, and we're happy to help at that point as well.
Because will we have exchanges here or not? What's the deal on that?
The state of Florida does not have an exchange, but in Florida you can participate in the federal exchange. So that's really only if you're going to be eligible for a subsidy is when you're going to go on the exchange.
But now you get subsidies up to making $90,000 a year? You can get a subsidy?
For a family of four, just a little over $94,000 a year.
Do you remember when $94,000 a year was a good amount of income at home? What the hell happened to America? $94,000. I mean, my parents' house was $20,000 in 1968. So that's 4 times that. Deb, what was your about the same, right?
About the same. I think
Right?
I was a couple years ahead of you, but it was about 1962. I think they paid it like $16,000 in Gainesville.
So
Cheap.
up to $94,000 a year, you're still going to get federal subsidies.
That's very possible, yes. And for an individual, it's going to be a little under $44,000, right around that number. Those are things that we can help you with. Not everybody's going to want to take a subsidy, but it's available out there to you.
Well, it's good to know, right? Because literally people were saying, you know what, if you're at a certain amount of money, a certain income level, you might not want to get to the next income level because you'll lose subsidies and you might lose your insurance or things like that. So, I mean, this is this is going to be a roadmap. All those books of, how to chart the waters of Obamacare and the Affordable Care Act. I mean, it's really true. But obviously, working with someone like you really do sound like you know what you're talking about there, Alex. So, that's going to help people.
That's definitely going to help. And so, again, you're not paying a fee for it. You're talking to people that understand what's out there. If nothing else, it makes sense to get the education.
Right. I like it. Well, check them out. It's the CMA Health Agency, stressfreehealthcare.com. That's the website. Very easy. They're also on Facebook, CMA Health Agency. You can call them at 855-258-2580. Alex is his name, but you've got 6 other agents besides you, so there's always probably somebody there that they could talk to. What are your hours typically?
We're typically there from 9 to 5, Monday through Friday, but we take calls after hours and on weekends as well, so it's pretty easy to get a hold of us.
That's a great thing about cell phones, right? You can never hide anymore. I really am jealous of my father. He was able to hide. Nobody. Where's your father? I don't know. Glenn, where's your? I don't know. We don't know where he is. And that's the world has changed. Now there's no hiding. My kids call me at any minute, any time of the night or day. It's rough stuff.
That's the way it is in our day.
It's
that's
not
because
right.
it's you can't buy a house for $20,000 anymore. So
That's
you have to be
right.
available
That's
all
the
time.
problem.
That's what you have to pay for, right? So, all right, we got plenty more.